Groups have been defined as two or more people who interact with one another, share similar characteristics, and collectively have a sense of unity. At my workplace, we meet each Thursday to take part in a group meeting called IDT, which stands for Interdisciplinary Team. The purpose of this group is to discuss our patients. We talk about what is going on with them physically, mentally, and emotionally. We discuss their psychosocial needs, spiritual needs, as well as their medical needs. The history of this group. This group has always taken place at my workplace. It is mandated by Medicare. Size, composition. Key members of this group include the medical director, social workers, nurses, CNAs, volunteer coordinator, chaplain, and the CEO. Group cohesion. This arises when bonds link members of a social group to one another and to the group as a whole. Our group cohesion is our bond between our patients. We each share a specific patient with each nurse and each social worker and all the other disciplines involved. The leader of our group, of course, is the medical director. The group is professional, and it normally runs pretty smoothly. Each team member takes turns discussing their part in the agenda. However, the group is very interactive, and each member chimes in when needed. Our group functions as a task group, specifically a team task group. A team can be defined as a number of individual staff members, each of whom possess particular knowledge and skills, who come together to share their expertise with one another for a particular purpose. For this type of group, I think it fits into the categories of system theory and field theory. Systems theory. This attempts to understand the group as a system of interacting elements. Integration is a part of this theory. It is ensuring that members of the group fit together. Ours do that because each individual is a professional and they act in a professional manner and they're all there for a specific reason. Adaptation. This is ensuring that groups change to cope with demands of their environment. Sometimes there are outside conflicts that occur and affect our group. If a team member is absent, for example, their input is still needed to go on with the group, and it must be submitted somehow or reported. Pattern maintenance. This is ensuring that groups define and sustain their basic purposes, identities, and procedures. Sometimes in our meeting, this is a difficult process. When staff members are discussing the patients, they may interject additional information that is not necessary. Goal attainment. This is ensuring that groups pursue and accomplish their task. In our meeting, we have a specific agenda to go by to help us. Field theory. This is another theory I thought would relate to this group. This is a group has a lifespan and occupies a position relative to other objects in the space and is oriented toward goals. It locomotes in pursuit of these goals and may encounter roles. Roles refer to status, rights, and duties of the group members. Each member has a specific duty to help each patient with their goals in our norms. That's another concept of this theory. They are rules that govern the behavior of group members. This is completed by having our specific power. This is the ability of members to influence one another. I think as long as each group member in our group behaves professionally. Cohesion. This is the amount of attraction the members of the group feel for one another and for the group. This is done by our common goal, which is our consensus. This is a degree of agreement regarding goals and other group phenomenon. This is completed by our goal of helping our patients. The final concept is balance. This is the potency of goals and objects in the lifespan of the group. This is finalized by our plan of care that we complete. Based on these theories, our group will not be able to function effectively without there being a high level.
Created using Powtoon.